So the philosophy of care at the birth center, it aligns with the traditional midwifery model of care that is focused on low intervention and physiologic birth. I always say I practice relationship-based care. So it's, longer prenatal appointments. It's really getting to know your patients and what's important to them, what they value, their family unit as a whole.
It's a more hands-on approach. It's a much more about the entirety of the pregnancy, not just having the baby.
Midwives generally tend to approach pregnancy from the standpoint that this is a natural thing that women have been doing since antiquity, while also being able to recognize when things maybe veer from being low risk and managing those situations appropriately.
We both have certifications as nurse practitioners and midwives. So when they come here, they can trust that they are still being taken care of by medical professionals, just in a different environment.
We want women to understand that this is their birth experience and that they're leading the way.
Every woman deserves a midwife because I feel like we are in their corner always. Midwife means with woman, and we take that very seriously.